The opinions expressed in the following program are not necessarily those of Eastlink TV, its sponsors, or partners.
Welcome to Your Health, the program about healthy living, good health promotion, and health care. I'm Dan Lessard. Seniors are one of the fastest growing segments of the population right across Canada, Ontario, and especially in northeastern Ontario and Greater Sudbury. And as such, their health concerns and issues are becoming more part of the public discussion and public debate. So we decided that we would talk about seniors' health on this episode of Your Health. And I have two of Sudbury's foremost experts on seniors' health to join us in that conversation. We're joined by Dr. Joanne Clarke. She is a geriatrician, the only one in northeastern Ontario, with the Northeast Specialized Geriatric Service in Sudbury. Dr. Clarke, thank you so much for joining us.
Pleasure.
And David McNeil, he is the Vice President of Clinical Programs and Chief Nursing Officer at Health Sciences North, and he's one of the lead advocates in transitioning Health Sciences North into a seniors-friendly hospital. David McNeil, thank you for joining us as well.
Well, thank you.
So much talk has been garnered recently about issues surrounding seniors' health. So I'm so glad that both of you are here today to talk about some of the best practices when it comes to seniors' health and how seniors, regardless of where they are, can enjoy optimal living and good, healthy practices. So Dr. Clarke, let's start with you. You are in the field. You're working with seniors on a day-to-day basis. What are some of the unique challenges facing seniors when it comes to maintaining good health?
Well, seniors, the reason I love what I do is because seniors are such a heterogeneous population. So in many ways, there's no one answer to that question. There are many seniors who age very successfully, are very healthy, and really don't have a lot of challenges versus a younger individual, for example. And then there are others who may age with more challenges. And the patients that I have aren't worried about getting old, they're worried about getting frail. So it's about avoiding frailty. One of the common things is as you age, you're more likely to develop more chronic conditions. You're more likely to develop disabilities. And so managing the multiple chronic conditions that can accumulate with age can be the biggest challenge.
And that's certainly something that's being witnessed at Health Sciences North, David McNeil. When you're dealing with seniors, sometimes they might come in for one condition, but you're also treating them for multiple conditions. What's your perspective on some of the challenges facing seniors when it comes to maintaining good health?
Well, and I think one of the things that we see as we look at the hospital, and we do see people come in with a condition, one of the challenges that we face in healthcare is making sure that we can actually stabilize that patient's condition as they come into the hospital, but also make sure that we look at them more holistically so they don't get worse. And that we can transition them into the community in an effective way. So maintaining senior health really requires a system view, not only in the community, but as people get acute care or become acute in their illness, that there is a system in place within a hospital to make sure that we're looking at their overall health conditions and trying to avoid them from becoming frail, because that is one of the challenges, of course, when seniors do become acutely ill, they are at increased risk for frailty.
Both of you have brought up the word frailty, so let's talk about what frailty is. Give us a clinical definition of frailty and some best practices that seniors can put in place, or their caregivers, to avoid frailty.
So frailty is what we call a geriatric syndrome. There are multiple geriatric syndromes, and when we go through medical training, typically we learn about diseases, right? So if you get a disease, you get multiple symptoms. If you cure that disease, the symptoms go away. Geriatric syndromes are different. They are what happens when you accumulate multiple deficits across multi-systems. So you get a little bit of visual impairment, a little bit of muscle weakness. Maybe you have multiple chronic conditions and you need multiple medications. Maybe you are at risk for dehydration. Maybe you're not as strong as you used to be. Maybe you're not as active as you used to be. Maybe you have a bit of depression, maybe some cognitive impairment. And all these little deficits add up to create a syndrome, whether it's a fall, whether it's delirium or acute confusion, whether it's some cognitive impairment, or whether it's frailty. So the trick is there's no magic bullet for that. So you can't, it's not like you get a disease, you cure the disease and the symptoms go away. In order to address something like a geriatric syndrome, frailty or falls or delirium, you need to address all those interrelated deficits and optimize them and modify them in order to prevent the syndrome from developing.
It would seem like it would be a combination of little measures that would be very successful. David, I noticed you nodding your head when Dr. Clarke was talking. What are some of those little things that seniors can do in their home or whatever setting they might find themselves in, or their caregivers can do to improve their health and minimize or lessen the chance that they might become frail?
Well, the good news is most of these syndromes share common risk factors. And there's good data and good studies to show if you modify these risk factors, you can reduce the risk of falling by up to 35%, of delirium, of all of these syndromes. Common things that come up is optimizing vision. So making sure that you get your yearly eye exam and optimize vision as much as possible, optimizing hearing. Making sure people are hydrated. 90% of the people I saw in my clinic last summer were dehydrated, clinically dehydrated. One of the things that can decline with age is the thirst response, or the recognition that they're thirsty. Even people with chronic conditions like heart failure and kidney failure, we say you need to be drinking roughly 1.5 liters of fluids total in a day. Most people aren't even doing that.
So something as simple as I'm drinking more water.
Just keeping hydrated. Yeah, prevents falls, prevents delirium, very clear risk factors. Of utmost importance is staying active. So frailty, falls, delirium, all of them have been shown that if you keep people moving and mobile in the community, within the setting of their acute hospitalization, you can prevent the onset of functional decline and frailty. And this is at any age, and this is at even people who have mild cognitive impairment to severe dementia. Keeping people active, physically especially, has been shown to reduce functional decline.
That's being done right now in Health Sciences North with several programs, I understand. Could you just talk about what you're doing at Health Sciences North to make it a more seniors-friendly hospital, and also to make seniors who are in care more mobile and less likely to develop, further chronic conditions or further symptoms?
Sure. When seniors present to the hospital, often it's through our emergency department, and one of the first things that we've put in place in recent years is what we call a geriatric emergency nurse. That geriatric emergency nurse is able to assess upfront many of the patients that would be at risk for frailty or at risk of deterioration because of their elderly condition. The other components of the program, of course, once people are in the hospital, we've created a couple new programs in the last couple of years. One of them is called our Elder Life program, and that Elder Life program is a volunteer-based program whereby we provide volunteers to go in to talk to seniors, to interact with seniors, and the evidence on that is that it reduces cognitive decline. It does give seniors motivation to do things like move and to interact, and the outcomes have been very positive. The other thing that we've created at the hospital to help deal with many of the geriatric conditions is what we're calling our acute care for the elderly unit. We call it our ACE unit, where we've added some additional resources, therapy resources, clinical experts, and it's a 12-bed unit, but it's really there to help focus on those seniors that are at most risk and are those that have the best opportunity for us to interact with or intervene with to improve their health conditions. So those are some of the small things we're doing. We have other programs, of course, that we're putting in place as well to support them on an outpatient basis.
Is it as simple as getting a senior just to get up and walk, whether they're in a hospital setting or a long-term care home or their own living room, getting them to walk, getting them to do a puzzle, getting them to talk to someone on the phone, drink a little more water? Is it as simple as little things like that that's going to greatly improve their health?
It really is. I always worry that people are going to find out that geriatric medicine's not rocket science, that this stuff are really simple interventions, and quite frankly, it's often not medical interventions. In the hospital, it's often caregiver or nursing interventions, and in the home, it's almost solely caregiver interventions. It's really optimizing vision, keeping hydrated, keeping cued, keeping active. Now, if it's as little as walking, I'm not so sure. It would depend on your fitness state. So someone who's a very fit older adult, I would expect them to be doing more exercise and more strength and balance training. And the more frail you get, you would obviously wind back that recommendation. But strength and balance training is really the most important in terms of reducing falls and optimizing balance.
What are some simple things that seniors can do to improve their strength and balance training? Not only when they're in their own home setting where they have more control over their environment, but also when they're in an institutional setting where they might not have as much control over their schedule, their diet, their recreational time. So what are some things that seniors can do regardless of the setting they might find themselves in?
Well, the good news is most retirement homes now, in fact, all retirement homes have a physiotherapist connected with and as well group exercise programs. And in long-term care as well, there are physiotherapy services in long-term care. The challenge is probably most of us who are in the business would say there's not enough to meet the needs of the residents. So I would encourage at every point along the elders' continuum of care, their life journey, to have a focus on maintaining activity, and whether that's making sure that you're bringing them for a walk when they're during their hospitalization, making sure that you get some private physiotherapy in if you can, whether you hire a PSW privately yourself to assist them if you can't do that, or teach them their own. CCAC has a home support exercise program as well. So the community, there's a lot of community providers now who are understanding the need for keeping seniors active, and will teach seniors and their caregivers these simple exercises to do on their own.
Even if they never get out of the house.
Absolutely.
And culturally, I mean, one of the challenges in healthcare is many of us as healthcare professionals, and I think even as when we look in society, when you come to the hospital, for example, what do? You put people to bed. And changing that cultural mindset for both, I think, patients and healthcare professionals is something that we're trying to focus on with 14 other academic hospitals in the province, and we're implementing a small initiative. It's called Simple, Move On. And really what it is about early mobilization of seniors. And through those mechanisms, it's one way that hospitals can help reduce the functional decline that often occurs when seniors enter into an institutional setting like a hospital for an acute exacerbation of an illness.
One of the things that has been talked about in regards to seniors' health, and it's gotten a lot of media lately, is this whole idea, this vision of shifting seniors' health away from an institutional setting like a hospital and putting it more into the community. I think it was talked about by the Health Minister, Deb Matthews, and her new vision for healthcare in Ontario, and also was mentioned in the Drummond report on how to reform Ontario's finances. The shift from institutional care to home-based care, which would seem counterintuitive to some. They might think that an institutional setting is the best care for seniors. But why is a home setting the best care for seniors?
It's, to me, it makes absolute sense. So the biggest word, hospitalization, the hospitalization is the biggest risk factor for creating a new disability. So there's been studies done out of Yale that shows in people who are 65 years of age and older who are not disabled at baseline, they followed them out over time and said, well, what are the conditions that are going to lead to greater disability? And things like suddenly developing heart failure, COPD, suddenly having a stroke increased your risk of becoming disabled by 1.3 to 1.6%. Suddenly becoming frail increased your risk of disability by, it's not 1.3 fold. It's having frailty increased your risk of disability by 2-fold. Being hospitalized, 60 times more likely to become disabled. So being acutely hospitalized, there's something about that hospitalization process, aside from the development of acute illness, that leads to disability.
Go ahead. We have about a minute and a half left. I'm going to get our hospital expert in on that.
Yeah. So partly iatrogenic illness or infection when you're in a hospital. Partly the added medications. Partly the fact that you're on bed rest for a long time. So bringing the hospital to home can prevent a lot of that iatrogenesis. That
I have to get David in on that point.
Sure. I mean, and I think that's going to be part of our challenge as a system. Hospital care is often a required element of care. But making sure that we move patients out of the hospital and into the home and have good transitional plan from the hospital to the home so that we can ensure that we have good continuity of care is something else that we are going to be looking at as a hospital to do things like avoid readmissions of that elderly patient so that we can have a good plan of care that connects better the hospital and the community, and maybe even move it out to what we call a virtual ward. And a virtual ward is just simply bringing all care providers together in a patient-centered way, so the expertise follows the patient and we remove institutional boundaries. And I think that's the challenge of the system as we look forward in providing good seniors care.
I want to thank you both so much for coming in. I guess in summary, drink more water, stay hydrated, exercise mentally and physically, and have a good healthcare team that's going to follow your progress. Keys to good seniors' health, wherever they may be.
Thank you.
I want to thank you both so much. Dr. Joanne Clarke is a geriatrician with the Northeast Specialized Geriatric Service. David McNeil is the Vice President of Clinical Programs and Chief Nursing Officer at Health Sciences North. I'm Dan Lessard. Thank you for joining us on this episode of Your Health.